Hi, in this video, we're going to talk about how to identify candidates for speech therapy. Maybe you are a teacher, maybe you're part of a school staff, or maybe you're part of a treatment team for a child or a parent, and you're wondering, okay, is it the right time to recommend a child for speech therapy? So, a little bit about me at the time of making this presentation. I'm Josephine. I am the current webinar research and development specialist at Here Center, but I graduated from Cal State Northridge in 2019 with my bachelor's in communication disorders. So that's like a degree that's like half speech therapy and then half audiology. And then I'm also a licensed audiometrist, which means I'm licensed in California to do hearing tests or screenings for people across the lifespan, so from children to seniors. Last week, I recently committed to a audiology program, which is a clinical doctorate degree at Cal State LA, and I'll be starting in fall of 2021, which is when we're recording this. The bulk of this presentation was pulled from credible articles and sources from the American Speech, Language, and Hearing Association, as well as some other credible sites around the web. So I don't want you to think I'm pulling this from nowhere, this information. I know I am kind of focused more on the audiology side, but there is a lot of research here that went into, how can we really make this helpful if you're a school staff member, if you're a teacher, or you're just a parent who's curious about speech development. So going forward here, so if this is your first time learning about Here Center, we are a nonprofit speech and hearing clinic in Pasadena, California, where it's our mission to help everyone of all ages receive affordable and complete hearing and speech services. We do speech therapy, audiology, lots of stuff with hearing aids, and also hearing protection since 1954. And even during the pandemic, we're doing all we can to make our services accessible using virtual teletherapy, making sure our clinic has all the latest, we're following all the latest CDC guidelines and recommendations. So we're doing our best to make it safe during the time of the pandemic. Community outreach is such a big part of what we do, and we're really grateful that we can still offer you these webinars for free, which would not be possible without the help of our donors, members, and community. So if you're watching this video, thank you. You are supporting us, believe it or not. So we hope it's helpful. So just some quick notes. All of our live presentations, all of our presentations that we do live are recorded at a later date without an audience so that they can be uploaded to YouTube, such as this video here. And it's great if you missed it, or if you want to rewatch it or share it with friends and family that you think might benefit from the info. We do make it a point to make sure all of our webinars are uploaded to YouTube. If you haven't made it yet to one of our live webinars, we do a live Q&A at the end of every webinar with either a licensed speech or hearing professional. So if you have a burning question and you would love to speak with a speech therapist or an audiologist in real time, we would highly recommend you join our live sessions, because you have that chance for a really helpful discussion if that's what you're interested in. Another reason to sign up for our webinars is that we always send a follow-up email with links to not only the YouTube recording, but other helpful information, such as links or maybe helpful PDFs that we think would be helpful for you. So that's another reason to sign up for our live webinars. So we've just divided this webinar into 4 sections. First, we'll talk about the terms and concepts around speech and language that are good to know. These will help you identify problem areas in your students or your children with their speech and language skills. Second, we'll discuss some concrete signs of speech and language issues, things you can look out for in your students going forward as they begin to return to school. When you identify those students who you think need, a speech evaluation, we'll talk about what to do next, and we'll conclude with a little bit about our services at Here Center. In this section, we want to give you some terms and concepts that can help you better describe the things that you see in your own students. So ways that you can look at their speech and language before you make the official recommendation for speech therapy. So what might these speech and language issues look like? So Jorge is 4 years old. It's hard to understand him when he talks, and when he speaks, it is quiet, pretty quiet. His sounds are also not very clear. Vicky is 15 and in high school. Since she was really young, she's had learning problems and as well as some trouble with reading and writing. She does need extra time to complete her tests in school. Luis is 12 and had a stroke. He understands the language he hears and does speak in complete sentences, but his speech is slurred and hard to understand. What all three of these young people have in common are communication problems, but their problems are different, and let's take a look at what makes them different. So speech is how we say sounds and words. This includes the concepts of articulation, voice, and fluency. Articulation is how we use our mouth, lips, teeth, and tongue to make speech sounds. Did you know that those are all the things that work together to make us speak? When a child has an issue with articulation, they may say the word bat instead of cat, or other mispronunciations. Voice is how we use our vocal folds and our breath control to make sounds, to produce voice and sounds. Our voices can be described as soft, harsh, strained, or even nasally. Fluency is the rhythm of speech. It could be how fast or slow someone speaks, or it could refer to the repetition of sounds, such as stuttering, or even pauses in speech. All of us can be disfluent sometimes. Anytime you say the word or hesitate, that's an interruption in the flow of speech. It's an interruption in fluency. So when a child is referred for speech therapy, speech therapists will not only look at how the child is saying and pronouncing words, they will also look at the child's language abilities. A speech-language pathologist will want to see how the child understands and expresses themselves. So language refers to the choice of words we pick to communicate, the words that we choose, how we combine them to share our thoughts and ideas and communicate our needs. One way to think about the difference between speech and language is to think of speech as mechanical parts working together to make sounds or speech. When one gear is off or not working correctly, it can make the whole machine sound different or a little off. While language is more like accessing a file cabinet in our brains with a bunch of different folders. When someone asks us a question, we pull out the folder that has the info to answer it. When someone gives us information, we put it away in the correct folder. In our brains, we have different folders for language. Language can be broken down into what words mean, how to make new words, how to put words together, and knowing what to say at different times. So with language, there is this sort of social aspect of being able to assess a situation and then follow through with an appropriate response. So when you think about a student or maybe a few students in your classroom, what do they seem to have more trouble with? Is it the mechanics of speech? Is it mispronunciation of words? Or is it maybe with filing with the folders? Can they understand what's being said, and can they express themselves? So with that overview of speech and language out of the way, a question that may come up for you if you're a teacher, you're a school staff member, or you're a parent is, are they on track? Is this thing I'm noticing normal? Will they grow out of this issue? And that's a perfectly fine question. Children's speech and language can improve over time without formal intervention like speech therapy. But if you don't know where to start, a good place to look at is a speech and language milestone chart. They're a really helpful way to roughly gauge a child's progress in their speech and language development. I say roughly because children are known to master speech and language skills at around age 5, while others master them at maybe 6 or 7. So there is some variation with this sort of quote-unquote schedule or calendar of milestones. I would go through every milestone, or every age of milestones, but that would make this video really long. So we're just going to focus on age 5, because most milestone documents or lists that you'll see online end at age 5. If you would like to know the milestones for other age ranges, you can definitely just do a quick Google search online. And we also have a document that does have milestones. So if you're interested, you can also just send us an email at info@hearcenter.org. All right, so if you teach kids older than 5, this could be sort of your reference point to see if the student is a bit slower in their development. If they haven't quite mastered some of these milestones, that's okay. You know, they might be doing it 6 or 7, but if they are older than that and you notice that, okay, they seem to be missing some things here, then I would start to maybe consider some evaluation. And on the other hand, if you teach kids younger than 5 and they haven't mastered these skills yet, then you might be happy to know that they're still developing and making their way towards mastering these skills. They still have a decent amount of time, you know, before they get to this level. So with hearing and understanding for age 5, they should understand the words for order. So first, last, and next. Words like that. They understand the words for time, such as yesterday, today, and tomorrow. They can follow longer multi-step directions, such as put your pajamas on, brush your teeth, and then pick out a book. They should be able to follow classroom directions, such as draw a circle on your paper around something you eat. And they can hear and understand most of what is said at home and at school. A 5-year-old should be able to say all the speech sounds in words. They may make mistakes on sounds that are harder to say, such as, words with L, with R sounds or S. But for the most part, they should be around 90 to 100% intelligible or easy to understand. They can respond to, "What did you say?" They should be able to name all the letters and numbers. They should be able to comfortably tell a short story. Use sentences that have more than one action word, such as jump, play, and get. They may make some mistakes, when they use these sentences, such as Zach got 2 video games, but I got 1. That's all right. A little bit of mistakes here and there are okay, as long as it's not a majority of the time. They know how to keep a conversation going. And they can talk in different ways depending on the place and who they're speaking with. For example, if your 5-year-old is talking to someone younger than them, they might use short sentences. And then if he's outside, he may know that he can speak and yell louder, but when he's inside, he knows he has to speak with a quieter voice. So around 5 years old in general, these are some of the major skills that a student should know how to do. Can you think of any students who struggle in a few of these areas? And just for your knowledge, there is no perfect case of normal or typical development. And that's because every child is on their unique schedule. All children go through the same stages of speech and language development, but when is the question. We don't know exactly when they'll hit each stage. And all this info about milestones is just a really helpful and general way to sort of place us or place them on sort of an undefined schedule. Other than the milestones, there are other factors that can, other than, the variability with development, there are other factors that can influence speech and language development. One of these are those children who come from a bilingual or a household where there's more than one language being spoken. Or if there's one language being spoken, then just them learning English at school. So bilingual students is what I'm trying to say. So according to ASHA, the American Speech, Language, and Hearing Association, on their website, they say that by 2030, English language learners will make about 40% of the entire school-age population in the US. And already there are around 60 to 70% of children in California who speak a language other than English. So it's a common concern for parents and teachers, to ask, okay, are children at a disadvantage because they're bilingual? The answer to that is no, they're not. This is a myth. And what may appear as delays in these students may actually be normal for a child who speaks two languages. Interference, code switching, language loss, and the silent period are common phenomena in dual language learners that can look like speech and language issues. For example, the silent period. So when children are first exposed to a second language, they may spend a lot of time on just listening and comprehending this new language. As a result, they may seem extra quiet in the classroom. And this is because they're really focusing all of their energy on understanding. So with bilingual children, sometimes a child can appear delayed, but what you might be seeing are just natural effects of being bilingual. We do have an upcoming presentation on this exact topic. It's actually going to be a presentation that we'll do in English and then one in Spanish. So we will do our best to have both of those uploaded after they have gone live. So that'll be a video you want to check out afterwards, after this one, perhaps. So aside from being bilingual, another thing that can affect the development of a child's language is some of these factors. So what is the child's natural ability to learn language? Do you notice some students who seem to pick up on language or certain aspects of language quicker than others? Do you notice other skills? Or is the student learning other skills right now that could be overshadowing their learning language abilities? Maybe for the student you're thinking of, maybe they're more focused on artistic expression, or maybe they're really into physical movement like sports and other like movement heavy skills. And how often is the child exposed to language, whether at home or at school? Is there a lot of conversation that happens around them? You may not be able to know this yourself if you're, a teacher or you're on the school staff, but this is a huge factor in language development. Children need good models of language in order to develop good speech and language skills. And when children, make a bid for conversation or they communicate with us, how do we respond to them? Do we acknowledge them and, kind of keep the conversation going to see where it lands? Or do we sort of redirect the child because we're maybe too busy or we have other things going on around us? How we respond to children's desires for communication can affect their language development as well. So to summarize, before we default to, okay, they need speech therapy, we want to think about a couple of things, okay? Milestones, which gives us, the rough framework of what children should be able to do with speech and language. We want to keep in mind if the child is bilingual, remembering that there are some common phenomena that may look like language delays, but they're actually just natural processes as a result of being bilingual. We also want to keep in mind these language factors that can sort of change how each child comes into language and how it develops. These are all factors that can influence the level of skill with speech and language in a student. So we've talked about the difference between speech and language, the milestones, and factors of influence. Let's talk now about some of the more noticeable signs of speech and language issues. Coupled with the language you may know now, you may be able to more confidently recommend a child for speech evaluation. So, in general, there are 4 areas of difficulty that may point to an issue. So with voice. Voice is how we control our breath and vocal folds, as I mentioned earlier, to produce sounds in speech. A child may have an issue with their voice if you notice a hoarseness or rasp to their voice, or if they speak abnormally loud or high. Articulation is, like I said, how we use our tongue, teeth, and lips mechanically together to make speech sounds. For example, the k in cat, being able to say that is articulation. So up to a certain age, a child will make these sorts of mistakes with articulation here and there, and it's completely normal. But if it's a consistent mispronunciation, such as tat for cat, then there might be a speech issue. Other than stuttering, an issue with fluency might look like an odd flow to the student's speech. So during a conversation, for example, they might start speaking and they stop in the middle of a really odd place, like a place that someone wouldn't normally stop a sentence in, and they would pick up again. Or instead of taking a breath before they start talking, they inhale in the middle of a sentence. So the timing of their speech, it just seems off. Lastly, language, as we know, is how we express our thoughts and how we understand what's said to us. An issue with language can look like trouble putting words together, trouble expressing thoughts or feelings, or issues with following directions. It's easy to misinterpret that as troubling behavior where they're just not listening well, but in reality, they may just not be understanding what is said to them. So an article on Edutopia had a really nice list of signs that you can pay attention to with your students. And as you'll see, they will touch on the 4 areas that we just talked about. So one issue that a child may have, or one sign that a child may have a speech issue, is that the parents or caregivers seem to understand the child, but in your classroom, you just really have a hard time understanding them. By age 5, children should be around 90 to 100% intelligible, minus a few mispronunciations here and there. If you can't understand them in most instances, then they might be a good candidate for speech therapy. If a student has trouble putting words together in the correct order, and if they have difficulty expressing and understanding ideas or their feelings, then this could be a problem with language. By age 5, children should be able to tell a story, have a conversation, and answer simple questions. If they respond in odd ways most of the time, or if they can't express themselves clearly, either through speech or writing, it points to a possible language problem. Difficulty retaining new words and lack of a large vocabulary are other signs to look out for. If we think back to the analogy of a filing cabinet, which holds sort of all the instructions for language and as well as the new words we learn, there could be an issue with retaining language if they cannot, or if they have a very, limited vocabulary range. By age 5, children should know about 2,000 words. So if they're using a very limited vocabulary, it may indicate that there is a language problem as well as a retaining problem. Consistent inappropriate use of grammar is also another sign, as well as regularly using words incorrectly. This could be just not in the right ways or in the right places in their sentences. It's noticeable not only in speech, but maybe in writing as well. Trouble using an inside voice, meaning that they might speak at a high and loud volume in inappropriate places, could indicate a speech or language issue. That could be a problem with regulating their breath control, which a speech therapist would be able to help with. Hearing or seeing words but not understanding the meaning is a sign of a potential language problem. They may be able to read a passage off the page, but if you ask them to explain or summarize what they just read, they may not be able to. Another sign may be a student who is frequently confused when you give them directions, either one-step or multi-step directions. By age 5, children should be able to follow directions at home and at school with little to no issue. If they don't seem to understand tasks most of the time, there could be an issue with how they are processing language. Do you notice poor social interaction between certain students? If you notice a student or a few students having trouble expressing themselves or understanding what their friends are saying, it makes sense that they could come off as a bit aloof or awkward with others. They may lack the language skills to maintain friendships or make new friends. Difficulty reading could stem from many things, but it is listed here as a sign of an issue with speech and language, so it could look like trouble pronouncing words, the pace at which they read. Can they remember what they read and summarize it if you asked? These are signs of language issues. So as you can see, when a child struggles with their speech and language, it can manifest in several different ways. We're looking at not just the way children articulate, but the way they use their voice, the flow of their speech, if they understand what we say to them. If you weren't sure what signs to look out for, we hope that this small list gives you a good starting point. If you combine this with a milestone chart, you could have a more complete picture of which students need more support or who may benefit directly from speech therapy. And before we move on to the next steps, after you've thought, okay, I definitely think this student could benefit from speech therapy, I want to ask a quick question. Have you considered that a child with an undiagnosed hearing issue could be contributing to maybe any speech or language symptoms in your classroom? So if you think about it, if a child cannot hear how words are supposed to be pronounced, it makes sense that they might mispronounce a lot of words. They're just not hearing how the words are meant to be said. So Asha has a handy list of signs that may point to a child who needs a hearing evaluation. Okay, sorry, my dog was barking at another dog outside. So if you notice your student who does not always respond to sounds, if your student doesn't say many words, has unclear speech, doesn't follow directions most of the time, says huh or what a lot, and does not answer when you call for them, then it may indicate that they need a hearing evaluation. And like I mentioned, if there is an undiagnosed hearing issue, either through frequent hearing or ear infections, or maybe, something else with their hearing, this can cause a delay in language development. We need to be able to hear speech in order to model it and and say things correctly. And not only that, but just understanding how language operates and how it functions. So if you notice any of these signs, a student or a child would benefit from getting their ears checked, first by a physician and then, if needed, an audiologist. Undiagnosed hearing issues can lead to unwanted delays or other issues in speech and language development. So the purpose of speech therapy is to help students speak in more useful and functional ways. If you think that a child may benefit from this, here's what we suggest you to do, and it's really not that complicated. So continue observing the child or the student and take down notes of what you notice. It might be helpful to think of the 4 categories of common difficulty, which is articulation, voice, fluency, and then language. What area does your student struggle with the most? It's possible to have issues in one or more of these areas at the same time. Another good reason to keep notes is that if a child does go forward with a speech therapy, the SLP or SLIPA will most likely ask you for your experiences with the child, what you've noticed in the classroom, and so on. After you've documented these consistent issues with signs of no improvement, then that would be a good time to look into speech services. If the child you're thinking of is younger than 5 and between the ages of 0 to 3, early intervention is recommended for any noticeable speech and language issues. Early intervention just offers services to help babies and young children, as you see here, with delays and disabilities, and it can lead to an increase in positive outcomes. This is great because over time this will mean less time and money spent on therapy for the family. So we do have a PDF file that we would be happy to send to you, and you can also forward to families if you're part of a school, which has tips and strategies to help support and manage children who do show signs of needing early intervention. So if you would be interested in that, again, send us an email at our email address below. But in general, here's some signs of early speech and language issues for children who are 0 to 3. So saying only a few words, not understanding what others say, lots of trouble in general, just making sounds or words, trouble playing with and talking with other kids, so that's sort of like the social aspect, problems with early reading and writing, being hard to understand, and having a hoarse and scratchy voice are all signs of early speech and language issues. With careful observation, you can confidently recommend a child for early intervention if you feel the need to do so. The earlier a child receives proper help, the better. But for children who are 5 and older, here's what we generally recommend. Gently bring up your concerns and observations with the family or caregiver. Phrasing your concerns in a question format might help the family members get on the same page. So, for example, I've noticed Stephanie has a hard time following 2-step directions. By any chance, do you notice this too at home? If they say yes, then great, you're on the same page. But if they don't, well, you should still let the family know what you've noticed and how it's affecting the student's academic and social life. A visit to the pediatrician or doctor to rule out any hearing issues or other issues would be the next step. As we discussed briefly, hearing issues can lead to delays in speech and language if they're not catched in time. After that would be either a trip to the audiologist to get the child's hearing checked out if it's been a while, or to a speech professional for a screening. Before any speech therapy is started, a child must pass a screening, which is a pass-fail test, and it's simply, it's a checklist of which determines, is this child in fact, at risk, or do they possess possibly a speech or language issue? Screenings look at what the child understands, what your child can say, sound development, and the clarity of the speech, and then their oral motor status, so how the mouth, tongue, and teeth, like the mechanics of speech, how it all works together. And I'll just really quickly and briefly just touch on our services, because during the pandemic we have had to make adjustments to how we do certain screenings and assessments. So for more information on this, depending on when you're watching, we would recommend you send an email to our screening site coordinator, Angelica, and her email will be in the description below. But in general, if you are a school staff member, if you're a teacher or parent, we would recommend that you email us or call us with details about the child's situation. If you're a school staff member or a teacher, we would recommend you speak with the parent first to, say, hey, like, I think, this is what I've noticed in your child, and maybe we should get them, a screening just to see if they pass or fail. And then we can go ahead and schedule a screening with you. So there is, this is not the official assessment, it's just a screening to see if, they are at risk, or if they do possess some signs that indicate an issue with speech or language. And as you can see here, it may be followed up with a complete evaluation. At the time of recording, we are still doing speech screenings virtually over Zoom, just to make sure, all the families and parties involved are safe. A licensed SLP or SLPA will administer the test, and depending on their age, there will be different sorts of tests that we will use. Prior to the pandemic, we did do hearing screenings at various sites and also in our clinic, but we are not providing them for the time being. So instead, if you believe a child could have a potential hearing issue, we would first recommend that you get their ears checked at the physician or their pediatrician. And then if you checked off a lot of questions on the self-check questionnaire with, the hearing, then we would recommend you contact an audiologist for a hearing evaluation. So not a screening. I mean, at least with Hear Center, we don't offer screenings, but maybe another place does. So just keep that in mind. So that's it. So if you have any questions at all about the content that we shared today in this presentation, you can send me an email at josephinesarial@hearcenter.org. If you're interested in screenings, please send an email to Angelica Tamayo, which is atamayo@hearcenter.org. And like I said, if there's any questions, if you want to just share the, details about a child or a student you noticed and their symptoms, you can send us an email at info@hearcenter.org, and we'd be happy to help you out and see what we can do. So honestly, any of these emails will work. So with that said, I'll go ahead and close this video and hope you have a great rest of your day. Thank you.